Hello, my name is Jonathan Fritz. I'm the Chief Innovation Officer for Chime. It's my pleasure to welcome everyone to today's Chime Innovation Beyond the Edge. This 12-part series is designed to share creative problem solving in response to COVID-19 and highlight innovations implemented by your peers. Today's session is Digital Transformation in the Age of COVID-19 and What's Around the Corner. A special thank you to MediQuant, our supporter for today's session. We know you are incredibly busy at this time, so we appreciate you joining us today. I wanted to take just a brief moment to talk a little bit as to why Chime is presenting this series. We've seen many challenges and problems through COVID-19. Many of our members are facing difficult times and their organizations, and with those challenges and problems are also opportunity for creative problem solving. Chime members have faced these challenges such as setting remote workforce, spinning up and training clinicians on telehealth, infrastructure, resource constraints, many others, and now how to really plan for the next phase of this war as we transition to a new normal. So from what I've seen with our members, they're some of the most creative problem solvers, really leading innovators. And innovation really isn't all about bright, shiny objects. And during these times, there's some really significant innovations that are positively impacting and saving lives. And those are really the most impactful and valuable innovations, period. So before we get started with the presentation, I'd like to take a few minutes to cover a few details. Our session will have two main parts. One, the presentation from our speaker, and two, a virtual roundtable session with 4 to 5 people in each one of those sessions so that everyone that's attending can have a candid discussion about the topic that's being presented. First, we're going to hear a presentation by Sara Vaezy, the Chief Digital Strategy Officer at Providence, St. Joseph. At the end of the time, we'll bring everyone back together to wrap up and review any outstanding questions and follow-ups. If you're unfamiliar with breakout rooms, that's okay. I'll give you a few instructions prior to splitting participants into those breakout rooms. We'll have everyone muted during the session. If you'd like to ask a question, please use the chat function to alert the team. The chat window will appear on your right side panel for that. Also, we are recording this presentation. This will be saved and stored on the Chime site, so you can go back and review any details once we finish. Discussions within the breakout rooms will not be recorded. If you have difficulty listening to the live audio stream through your computer speakers, keep in mind you can connect to audio via phone. If you need help with that or any other technical detail, please use the chat window to send us your questions. For those connecting via phone and your computer, please message the host with your name and phone number. Our host will merge your phone and computer connections. Lastly, by attending today's session, you will earn 1 continuing education unit for CHCIO, CFCHE, and CHISL certifications. We will review the attendee list following the session and distribute CEUs accordingly. With that said, I'm going to hand it over to Heather McGinn, Regional Vice President at MediQuant, to introduce our speaker for today. MediQuant has been a very strong supporter of Chime, and we appreciate their support as one of our Innovation Beyond the Edge series supporters and a supporter for today's session. Heather?
Thanks, Jonathan, and thanks to you all listening in today. It's a pleasure to be here with you. As Jonathan mentioned, I'm Heather McGinn, Regional Vice President of Business Development at MediQuant here in the West. We're really proud to partner with Chime today to bring you not only today's Innovation Beyond the Edge session, but the entire series. Since 1999, MediQuant has been helping health systems better leverage their valuable legacy, clinical, financial, and ERP data. Our customers comprise of more than 350 healthcare systems around the United States, and this pandemic has impacted each one differently. MediQuant is very fortunate. Our staff was already well positioned to work remotely, but more importantly, during this truly unprecedented time, we do not have to be on site to perform system transition services, or to implement our enterprise archiving solutions. Our focus remains on supporting our clients however we can, in whatever way they need us to, so that we may achieve our shared vision of providing clinicians and hospital staff secure access to all of the data they need to faster and more informed care decisions to manage their business operations, improve patient safety, and increase satisfaction for patients and clinicians alike. With that, it's my pleasure to introduce Sara Vaezy, Chief Digital Strategy and Business Development Officer at Providence St. Joseph Health. Sara is responsible for the digital strategy, partnerships, and roadmap for Providence's 50-plus hospital system. She also oversees business development and Providence's sustainable incubation process, which has launched several successful ventures. Her commitment to impacting healthcare through innovation and quality outcomes has recently landed her on the Becker's Hospital Review list of the Rising Stars in Health IT and Women to Watch in Health IT 2020. She was also featured on Business Insider's 30 Under 40, Transforming the Future of Healthcare. Today, we all have the privilege of hearing her speak about digital transformation in the age of COVID-19 and what's around the corner. With that, Sara, I'll pass it over to you.
Thank you so much for the very generous introduction, of which I am not worthy. So I sincerely appreciate everyone's time and for this opportunity to kind of share with you all what we've done at Providence from a primarily consumer and patient digital standpoint in response to COVID, and where we think things are heading and how we want to adjust what we're working on in order to sort of meaningfully tackle this, this crisis. Next slide, please. So just a little bit about Providence, though many of you probably have heard of us, at least in a cursory way. We are a 51 hospital system in the Western United States. And we are across the states that are shown there. We're vertically and horizontally integrated to a fairly significant breadth and depth. So we cover quite a large population of individuals who we serve, and with very diverse needs and a lot of different kind of local sort of communities that, in particular in this situation, the local aspects of things are very important. So next slide, please. Our mission is health for a better world, or our vision really is health for a better world. And we're very committed to keeping people healthy as whole individuals, body, mind, and spirit. And we're doing that through the delivery of personalized care and working on ensuring that it's safe and convenient and accessible and affordable for all. As part of that, as it relates specifically to COVID, we've just been sharing our learnings throughout this process and disseminating them to the extent possible to other health systems so that we can kind of try to drive the acceleration of learnings and intervention as it relates to COVID. Next slide, please. One of the reasons we are sort of in a unique position is that Providence Regional Medical Center in Everett, Washington, which is a suburb of Seattle, was the first system to see a patient with COVID-19 in the United States. That was in late January. And since then, we mobilized very quickly under the leadership of our Chief Clinical Officer, Dr. Amy Compton-Phillips, and created quite a few sort of response structures, including an emergency operations command center and a lot of different sort of processes and cadence to mobilize, frankly, the entire organization to tackle COVID-19. Next slide, please. So what you see here is what the digital innovation group has done and how we sort of perceive the situation in terms of its phases from a consumer digital standpoint. So I'll talk about the phases just a little bit, and then I'll tell you what we did in the crisis response phase. So phase one, we're nearing the end of that phase. So we're at the end of the beginning, if you will, as it relates to what we're probably going to be going through relatively sort of acutely or in waves for the next several months prior to a vaccine, and then what will be the next normal. So the crisis phase was really how we all mobilized very quickly to contain, test, triage, and treat, as Dr. Compton Phillips puts it. So I'll tell you more about what we did from an end-to-end consumer journey in just a moment. We see these things moving into sort of two parallel phases from here. The first is, how do we get our patients safely back in to get the care that they need, by being a trusted resource, by providing them with thought leadership, by ensuring that they and our caregivers are continuing to be safe when they do come to see us, and putting in new modalities of care in order to be able to do that. And then managing, that's phase 2A. Phase 2B is going to be ongoing management of sort of at the community level, things like surveillance, contact tracing, and quarantine and isolation, ensuring that we can effectively manage through waves that are going to be likely for the next 18 months or so. And then the next normal is how we see our business model and our operating model and our care model changing as a result of COVID. So as it relates to the crisis response, from a patient consumer sort of standpoint, here's what we did. We started with awareness. So awareness is just disseminating information, having a home for it, ensuring that patients and our community at large, not just folks that were somehow affiliated with Providence, but those that were part of our communities knew the information that they needed, had the information that they needed at their fingertips. What should I do? How do I keep myself safe? What do I do if I have symptoms? That became the home for a lot of downstream resources, like an assessment bot, which was an FAQ and kind of simple assessment, NLP and AI-driven engine that did a risk assessment for our patients and then triage them to downstream resources like virtual visits, which we put in, we actually had in place, but scaled up dramatically throughout this process, throughout COVID. If folks needed a higher level of care, we then triage them to live testing locations, which I'll tell you a little bit more about. And then if folks needed even further care, we connected them into home monitoring. If they were either like PUI, potentially had COVID, or if they had actually tested positive but didn't need to be in the inpatient setting. So this was our end-to-end approach that we stood up very quickly, and I'll tell you a little bit more about each of these. Next slide, please. So under awareness, we call this our consumer hub, and it was the central home from a digital standpoint for information for our communities, like how to protect yourself, what you should do if you feel sick, how you can continue to stay informed, and then some of the resources that you see there around the assessment tool and getting care virtually. This page also led into some very specific regional pages with additional information about at the local level, because the local level is where a lot of the activity was occurring and some of the action was happening, if you will. And so there was a connection from the system all the way to the regions and the localities, and that was really really important. There's a lot of information at each of these places, as well as connection to resources, and needed to occur at multiple levels. So this was the home then for the assessment bot. Next slide, please. The coronavirus assessment tool is our chatbot, which was an online assessment tool that we put in place to answer some of those general questions that folks had about their symptoms, and then as well as FAQs. We actually launched with just sort of the symptom checking type of functionality, and then added FAQs over time. But patients or community members, so this was open to anybody in any of our communities, community members who primarily were worried well, although some were not well, they needed additional care, who had questions could utilize the bot, note where they were located, and then answer some simple questions around their symptoms and whether they've been exposed or if they knew they'd been exposed. And then either be instructed to just rest at home or get triaged into virtual visits. What you see at the bottom there on the lower left are some of our stats that we had in March. So we had over 650,000 visits to the homepage that I just showed you, the hub. And of that, from there, over 115,000 clicks on the bot itself. And those 115,000 clicks onto the bot resulted in over 1 million messages exchanged between consumers or patients and that bot. And then about 15% of those folks were then triaged into virtual visit, which is our video visit platform. And so this was a collaboration between Providence and Microsoft. The teams worked extraordinarily well together and were able to stand this up in a matter of days. Building on some existing bot frameworks that Providence and Microsoft both respectively had been working on for quite some time. At Providence alone, we'd been working on bots for a couple of years and had a framework in place that we had been utilizing for other sort of low acuity use cases like cold and flu and things like that. On our what we call Express Care, which was our retail medicine business. So we've been using that for quite some time and leveraged it and pivoted it for the coronavirus use case. Next slide, please. So if folks needed an additional higher level of care, we then triage them to Express Care Virtual, which is a telehealth, like a video visit for patients with symptoms that were consistent with COVID. That doesn't mean that they're necessarily positive, but that that the assessment that they did via the bot directed them here. This, as many of our team members, including our chief digital officer, who has oversight over our entire group, say this is like the best form of PPE is virtual, right? Virtual care. You're not in touch with one another. And this really helped to reduce our staff's exposure while still providing really excellent care to our communities. Referrals were provided from here to drive-through testing, which I'll tell you about a little bit as well. And we saw a 20x increase in virtual visits during the COVID, during the period of spike for COVID as compared to previous volumes. So in a few weeks in March, we saw more video visits come through Express Care Virtual than we did in all of 2019. And that is a sustained, that has been sustained, though not at the peak levels, but at a high level for the past several weeks. It indicates like folks are getting more accustomed to video visits, and that this has been a really great, again, something that we had in place previously, but we were able to pivot to serve a broader community and a new use case during this crisis. This also, I'll just make a quick note, sits kind of in parallel to video visits that we put in place in our traditional sort of ambulatory network. So our providers could provide ongoing care for non-COVID related things for our patients, like chronic disease management, that we still need those folks, and our patients still need that care, and they need to be able to communicate with their providers. Our telehealth, the Providence telehealth team and the physician enterprise stood up virtual visits within our physician enterprise, onboarded about 8,000 providers, and is now doing approximately 10,000 visits per day around our entire ambulatory network, providing care to our patients for those standard things that they continue to need. Next slide, please. So if folks needed from here continued to kind of need an additional level of care, we then directed them to live testing sites. So testing has been a major issue, of course, and we were able to stand up a lot of different types of sites, but it was really important to be able to direct patients to where there was capacity. So we, if folks were triaged into this, we were able to direct them with very frequent updates on where there was capacity to live testing sites within their location. So it's geolocated, as you can see there. And they were able to then go in and get a swab done. Next slide, please. And then finally, for patients who were being released, either discharged from an inpatient unit because they didn't need that high level of care anymore, or they had come into the ED and didn't need to be admitted, or had gone through virtual visits and needed home monitoring, but it didn't need to be in a physical inpatient setting. We deployed home monitoring via 2 companies that we've partnered with. Twistle, which delivered the actual pathway. It was like a 14-day pathway where we requested our patients to input via a very simple text message and a web form their data around their temperature, their pulse oximeter readings for blood oxygen, and some other qualitative questions, subjective questions. 3 times a day, that data went to our pool of tele-ICU nurses who monitored via alert and dashboard. And we integrated that into the EMR so that the nurses had a single pane of glass via Xealth, which provided both the ability to kind of prescribe the monitoring as well as monitor the data as it came in on an ongoing basis. Next slide, please. And then just one quick note on this. So one of the reasons why we were able to flex up and down very quickly on the virtual visit was we have a platform that we've used for same day care in the past, and we repurposed it for the COVID use cases that drove patients into our virtual visit when they needed it. It navigated them around and ensured that they got the right care. And it also, because it's so flexible, matched supply and demand very effectively. In this particular case, it just means it scaled up and the platform didn't go down. Next slide, please. We can skip this. I already talked about that. And actually I'll skip this one too, but this is basically just showing we were able to scale up and down because we have a near real-time slot inventory and the ability to serve our patients with a shared provider pool that could scale up really well. And there were some operational things that our teams did, that our Express Care clinical teams did, to get a lot of providers up and running very quickly so that we could operationally withstand and take on all of the new volumes. The last thing I'll talk about is something that wasn't on that initial slide, but this has been a very stressful time for our caregivers and for our patients. So we worked on making behavioral health resources available to our caregivers and our patients. Our clinical program services team that focuses on mental health has put in an amazing amount of work and stood up some incredible programs like a behavioral health concierge in a short amount of time and extended it across our network. And we augmented that with computerized cognitive behavioral therapy through a company called Silver Cloud that we worked with to be able to deliver modules for depression, anxiety, stress and resilience. And we are also connecting this to what you see here, which is we are asking folks to kind of rate where their own, their self-reported stress level is. And then based on where they rate themselves on this, they get directed to resources that are appropriate for them. So that's also been made available, and we can, this is going to be a continuing kind of opportunity and area that we need to focus on, just given the amount of stress associated with something that's unprecedented of this nature. So I believe that's the last slide.
Thank you very much, Sara. Really appreciate the presentation and joining us today to share what your health system has gone through and the steps that that you've taken to address COVID-19. So with that being said, we're going to transition to breakout sessions, and wanted to give a few instructions. One reminder is that if you have called in, as well as using your computer, please message our host and we'll merge those, because it doesn't work very well if you've called in and on your computer to be in the same breakout room. So we'll provide about 15 minutes for these breakout rooms, and we'll split everyone into these smaller roundtable discussions. At that time, please select the Enter Breakout Room button. Groups will be assigned at random, and you'll have 15 minutes to talk about this topic amongst your peers. Please take a few moments to introduce yourselves and select a group moderator to keep the conversation going. We don't think that has been much of a problem, because they've been very active conversations so far. We'll send along a few questions that prompt the discussion via the chat window. Be sure to check that out once the breakout session begins. If you need any assistance, please select the Ask for Help button on the bottom of your Zoom window, and a lead will join your discussion to assist. You'll receive a notification via chat when there are only a few minutes left, and a pop-up will appear asking you to return to the main session at the discussion time. One final suggestion, once in the breakout rooms, switch to the group view to better engage with all participants. And lastly, I'd like to thank our Innovation Beyond the Edge series supporters, which includes MediQuant, which is our session supporter for today, as well as Greenway Health, Philips, and our streaming supporter, Cover My Meds. It will take a few moments to distribute everyone into breakout rooms, so please don't forget to accept the invitation.